To a doctor who runs a cash-only clinic. It's a way around Obamacare, and he is thriving. He decided to post his surgery prices online. Whichever area you need surgery on, click onto it, and you get the price of a particular procedure for that body area, okay? If it's a shoulder, you pay this. You know, just look at it. That's what he's got on his website. The number of his patients has just gone through the roof. Why? Obamacare enrollees pay such high deductibles that it's cheaper for many of them to fly to his surgery center in Oklahoma, have the procedure through Obamacare. How about that? Than through Obamacare. Joining us now is Dr. Keith Smith, the aforementioned success story from Oklahoma. Doctor, welcome to the program.
Thanks for having me.
Right. So what I think is the big deal with you is that I can go on your website and you tell me in advance how much it's going to cost if I have my shoulder adjusted or my leg fixed or whatever it is. I know the price before I get there, and I'm going to save money if I come to you because the Obamacare deductible is much higher. Have I got it right?
You do. We put our prices online about a little over 5 years ago, and people have just been streaming in because they found they can actually buy health care now cheaper than they can buy the coverage. And it's not just the Obamacare plans. It's the effect that this legislation has had on the premiums of everybody's insurance policy. So people are increasing their deductibles and their own personal exposure to levels otherwise unimaginable. And they look at our website and they see that, you know, they can pay $3,740 for a knee arthroscopy, for instance. Whereas if they use their Obamacare or any other insurance plan, they might pay a $7,500 deductible plus a 20% copay at a facility, you know, that's supposedly not making a profit that charges $30,000 for the same thing.
You're laughing, and I'd like to see a man smile like this. Wait a minute. What about liability insurance? I mean, you're so cheap. Can you cover your liability?
Yeah, and the focus shouldn't really be on how low our prices are. The focus should be on how high the prices are at the so-called not-for-profit institutions.
Now, hold on, doctor. Hold on. I asked you a question. You got very low prices. Now, don't avoid the question. How do you take care of liability insurance?
We all have liability insurance with huge limits. I mean, we all buy the liability insurance. There's 60 surgeons at my facility, and we all have liability insurance.
So how do you get the price down so low?
We get the price down so low because our facility is completely owned and controlled by the doctors who work there. And so by virtue of that arrangement, we've eliminated the most greedy profit seeker from the equation, and that's the corporate institution. That's the hospital. Keep in mind, too, that we don't advertise, we don't buy out physician practices, we don't buy out competitors. Now, we're not building buildings all over the place, and so the reimbursement amounts, the charges you see on our website represent what it actually costs to deliver that care, not all the fluff.
I'm sorry we're out of time, Doctor, but you are a welcome guest on the Friday before Labor Day, talking to me about a decent price for a knee procedure. Just love it. Dr. Keith Smith, excellent. Thanks for being with us, sir. Appreciate it.
Thanks for having me.